Well, good afternoon. As we see this new surge in COVID-19 cases, as we see the second wave of this virus, we're taking action. My friends, over the last few days, we've seen me up here every single day talking about the fall preparedness plan. We have the most robust, the most extensive plan for the second wave of COVID-19 in the entire country. We're spending $1 billion to expand testing and contact tracing. We're hiring 3,700 more frontline healthcare staff. We're clearing the backlog of surgeries with an investment of $243.7 million. And we're freeing up hospital beds. And most importantly, we're protecting our most vulnerable. Today, we're announcing further action to protect our seniors. An additional $540 million to protect our long-term care homes from COVID-19. That's more than $500 million we're spending when we're sparing no expense. This funding includes $405 million to help homes with containment measures, staffing supports, and purchasing additional supplies of PPE. $61.4 million for renovations in the homes to improve infection control, including ventilation and isolation capacity. $30 million for additional infection control staffing and training for existing staff. And we'll ensure every long-term care home has a 2-month supply of PPE. And as we find ourselves in this new wave, our government must continue to make tough but necessary decisions to protect our seniors. We have to take action now to protect those we care about most. That's why we have to make changes to the visitor policy for long-term care homes. We're looking at this highest risk regions, the areas with high community spread. We're working with the Chief Medical Officer to identify those areas based on the data. My friends, this is not something that we take lightly. I know firsthand how hard it can be, but it's absolutely necessary. We can't let COVID-19 get into these homes. It's absolutely critical. That's why, as of Monday, October the 5th, visitors to long-term care homes in these areas will have to be restricted to staff, essential visitors, and essential caregivers only. But folks, we have made it possible for family members or friends to come in as caregivers. This kind of support is critical, and I encourage family members, friends, please sign up to be a caregiver, because showing up at a home for a few hours to help out, it's critical. It helps our loved ones, and it can help other residents as well. It means more eyes and ears looking out for our residents. It's easy to register, so I highly encourage folks to take advantage of this, because we must do everything we can to support those who are isolated during these difficult days. My friends, we're sparing no expense. We're putting up another $500 million to fortify our long-term care homes against this virus. For the sake of our long-term care residents, for the sake of their families, we will be there for them, we will protect them, and we will get through this.